Hello viewers, I would like to give my brief introduction to all of you. Myself Dr. Vinit Wankhede. I am a consultant pediatric neurologist and pediatric epileptologist working in Nagpur. I did my graduation from Government Medical College Nagpur, and later I pursued my post-graduation in pediatrics in BJ Medical College Pune. Thereafter I did my super specialization in pediatric epilepsy and pediatric neurology at two centers which are nationally recognized centers in Bharati Vidyapit Pune and also the Trivandrum Medical College Trivandrum. Being a pediatric neurologist and epileptologist, I deal with all the neurological problems of the children, right from headache, neuromuscular weakness, different type of neurological problems. I deal with all sort of, I give comprehensive care to all neurological patients, right from the patient investigations, clinical assessment, treatment, diagnosis, and various rehabilitation procedures. Presently, I give my all facilities to my own center, which is located in Lokmat Square, Nagpur, and which is just in front of Lokmat building above Jain Medical Store. I have my own setup where I do the OPD, where there's OPD facilities are available. Also the investigation facilities are available for all sort of neurological problems of the children. They range from diagnostic procedures like EEG, which is required for the patients of epilepsy, EMG NCV studies, that's electromyography and nerve conduction studies for the patients of the neurodeficits and the weakness of the different part of the body. And I also have BERA studies, that is a brainstem evoke response audiometry, which is required for the patients who are having a hearing problems, and also have a visual evoke potential studies, which are required for the patients who have vision difficulties. So all these problems I deal regularly, and I have a lot of data and number of patients who are dealing with this. I have my own clinic in Lokmat Square, as I told, and also I'm attached to the various hospitals in the city of Nagpur, out of which the important ones are the child hospital at Sitabardi. I'm attached to also Mediterranean Institute of Medical Sciences in Ramdaspet. I'm attached also to the Colors Children Hospital and Health City Children Hospital, and among other hospitals. These are all the pediatric hospitals I'm attached, and I'm also attached to the Orange City Hospital. These are the multi-speciality chain I'm attached with. The major chunk of patients whom I deal with are the children with epilepsy. Epilepsy patient needs a variety of diagnostic modalities and variety of the treatment modalities, and according to that I plan specific investigation. The EEG is one of that, and I have EEG facility with a video EEG which is 24/7. It's available here. Also I deal with the various patients with the visual deficits whom I advised mostly the visual work potential studies. Also the children with the hearing deficits whom I advise BERA studies. These are all the diagnostic procedures which are needed for those patients who require a comprehensive health care. Also I have EMG NCV which I advise for the patients of the different type of weakness, and the reason of which is mostly the muscular origin or the nerve origin, that I come to know by those performing those tests. Also I have a lot of patients with speech delays, speech difficulties whom I advise speech therapy. Also I deal with the patients of intellectual disabilities who may require an extensive workup in the form of IQ DQ testing, that's the intelligent quotient and the developmental quotient computation. We compute the scores by using different techniques and formulate an staging of the patient, and according to the grade of the patient we formulate a different individual specific plan for every single patient. Also we have a behavioral therapy for the children who have behavioral issues, also have psychiatric issues. I deal with the various types of child psychiatry problem, right from the depression to the anxiety disorders, also from the various stress disorders which are more common in children nowadays. I deal with the various types of headaches and different types of nerve problems. So these are all the list of children I deal with. I also deal with the various neurogenetic disorders whom the patients have deformations, the disfigurement or the congenital deformities. Those patients needs an extensive workup, and I have tie-ups with the various types of investigation facilities like MRI techniques, MRI, CT scan, and other people, and the neurogenetic studies, karyotyping, and the neurometabolic workup. Here also in Nagpur, I am attached to so many MRI center, and also in the various cities of the India where the facilities are not available in Nagpur. We had a tie-up with neurogenetic labs, so that the patient should not travel to those cities, and instead that the person from that center come here and gather the sample right here. So these are all the studies we have. Hello friends, we are going to see what we do with the patients of epilepsy. Whenever the patient of epilepsy comes, mostly he is complaining of the seizures. So he may have a single episode of seizure or multiple episode of seizures. What we do as a basic test to evaluate for these children is do an EEG. EEG stands for electroencephalogram. Just like you have been heard of ECG, which is the electrocardiogram. When you have chest pain, do a ECG, just like that we do in the patient of seizures, we do a EEG test, which is a basic screening test in any child or any adult suffering from seizures or seizure disorder. That the first line of investigations which we do. In next 5 to 10 minutes, we are going to look how simple is this procedure and how effectively it can be utilized in the management of the seizures. For that, first we must know what is a seizure. See, the seizures is nothing but it's a electrical output which is an exogenously formed in your brain, and when you have excess of those electrical activity in brain, you get a seizure. And how to detect that is this is the basic investigation tool, in which we apply the electrodes in a specific fashion over the scalp area, and here and from that we get an idea from where the excess electrical discharges are coming from the brain. So next 5 minutes we are going to look after how to apply these electrodes and do the procedure. Whenever we plan to do a EEG of the child or the patient, we ask that child to come sleep deprived. What the sleep deprived means, that you have to get up early in the morning on the day in which the EEG is planned. So the child or the patient should wake up at 4 to 5 o'clock or 2 hours before the usual time of awakening, and he should be awake till the time he reaches our clinic, so that during an EEG we want to get him asleep and also the awake, because the sleep and the wake cycles changes and we want to note the differences in the EEG. So first we ask the child to come sleep deprived, and so to wake up 2 hours prior to the usual time of awakening. And second thing, we ask the child to undergo a hair cleaning with a shampoo, and we ask the person not to apply hair oils, because that alters our electrical findings in EEG. So these are the two prerequisites which are required. Now we are going to see how we apply the electrodes on the child. You can see here, this is a scalp, here the nose, and the patient is vertically lying on a bed, and these are the various places where the electrodes are placed over the scalp, and the electrodes and the recordings from those electrodes are formulated in this form. I will show you how to apply the electrode first. So these are the electrodes. This is a machine from which the different electrodes are coming, and I have to selectively use the electrodes like this. So this is the electroconduit paste, and I apply the electrodes on the different part of the body. So these are the various scalp electrodes on which I'm using this paste, and this paste acts as a barrier to take signals from the brain to the machine. And here, see, as soon as we apply the electrodes, we will get a signal analysis from the brain, and we formulate a different type of graph like this. So unlike ECG, we have various lines, and it shows the electrical activity in your brain. So here it goes. So we have a series of electrical activity which is going on in your brain that gives us an idea what is is there any electrical abnormality in your body, is there any electrical